think the benefits of working at a LikeMind centre in comparison to, say, a private practice is we have a really great wraparound variety of services to provide holistic care for people. It's great for our staff in terms of their relationships within the community, their opportunity for learning. I remember I went to a managers conference and the CEO of Aftercare was asked, what do you like most about working for Aftercare? And the first answer that he gave was people. And that really struck a chord with me because it would be easy to say flexibility, career development, professionalism, but I think coming back to focus on people, that's the most important thing about what we do here at LikeMind.
The team nature of Aftercare, Headspace, I think is fantastic. Having the backup support of clinical leaders and caseworkers and the psychologists being literally just a door knock away, knowing that there's someone out there to support me and support the patient, more to the point, is fantastic and is invaluable as a GP.
I work very closely with our GP here. From my side, we've had a real mutual benefit from working together. I've learnt so much from working with him and he's learnt so much from working alongside our allied health team.
The huge reason that I wanted to come and work at Floresco was it's a balance between public and private. You definitely have the public hospital basis of having a multidisciplinary team and access to that, but then you also have the private element that as, a contracted psychologist coming in to provide my service, I can call the shots on my days and my hours. So I feel like it's almost the best of both worlds.
I enjoy the work with Headspace because it's dealing with a very interesting age group. Private practice can be repetitive, but I think in treating younger people, it's not so repetitive and each one's different. There's a sense of humour in the organisation and people can laugh and get on very well together.
What I really appreciate is that when I do arrive on a Monday morning, I have a full clinic, and if there's been any cancellations, the admin staff have filled them, the mental health care plans have been sorted and all the necessary paperwork, it's all been sorted. I'm literally all good to go.
Here at Aftercare, we have a system of clinical governance. Briefly, it means better clinical outcomes for our clients, better working conditions for our staff, and greater confidence in our services by the community.
We have a high focus on maintaining our staff and retaining them. So whether that's looking at professional development opportunities, investing in people to participate in different programs or projects, provides people that real engagement with the organisation so that they own their roles and own how we're growing together.
The Poppy Centre has really allowed me to develop my skills and knowledge. I'm at training every other month. It's really allowed me to provide the best service possible for our clients.
Here at the Poppy Centre we work with children from the age of 0 to 11 and their families. Being a private practitioner can be quite isolating. The good thing of having such a diverse multi-disc team is that there's a lot of different ways to address scenarios. So how I address something would differ from how psychologists may.
There's been no shortage of opportunity and innovation and the scope to be part of something bigger than just my role or just me, to build something from scratch. And that's pretty exciting in healthcare.